Pilipino. Ito ay alagang hindi makasarili. Alagang laging gumagawa ng paraan. Alagang nagkakaisa para sa bawat isa. Alagang handa sa anumang hamon. Alagang ramdam kahit saan ka man. Alagang maaasahan. Alagang nagbibigay ng solusyon at mga ngiti. Alagang busog sa pagmamahal. Yan ang alagang Pilipino. Alagang may husay at malasakit. Alagang nagpabayanihan. Nakikisama nila sa lahat ng Pilipino, walang sawang nagbibigay ng alaga para sa kalusugan ng bayan. Alagang tunay, alagang Pilipino.
I know there are people who say I can't do it. They think I can't handle it, that I'm not fit to play the game. And they think it's better to give up now. But it's not what others say that matters. It's what the people who believe in me say that counts. I know they will always be there for me. I know they want what's best for me. Because we are family. Because for them, I can do anything. For them, I am worth believing. For them, I can. This time, I can let my voice be heard. This time, I am in control. This time, I can. This time, I can dance my way to my dreams. And nothing can stop me. Nothing can stop me. Nothing can stop me. Not even asthma.
In the Philippines, 11 million Filipinos are afflicted with asthma, and of those afflicted, more than 6 million are children. Join us. Together we can beat asthma. Child Asthma Network, an asthma awareness campaign by Pediatrica, a division of Unilab. Trusted quality healthcare. Unilab yan.
Good evening, everyone, and welcome to our free webinar on caring for children with asthma during this pandemic. I am Tanya Soriano, and I will be your host for tonight. Before we begin our event, let me share with you some guidelines and reminders. This asthma webinar is a free Facebook event with an invited pediatric expert to help parents better understand the importance of continuing the care for children afflicted with asthma during this pandemic. The live event is intended only for related concerns about asthma in children. The pediatric expert in this live event adheres to share her general and practical knowledge and expertise, and it does not in any way substitute professional medical advice for any diagnosis or treatment. For more serious concerns, it is still best to consult with your own pediatric healthcare professional. Questions that will be raised during the live broadcast might not all be accommodated. Our speaker would only entertain questions in relation to the topic of asthma in children. Any personal identifiable information like full name, location, or full and sensitive medical history that will be shared during the live broadcast will be seen and can be seen by other people, and viewers are discouraged to share any. Unilab and their affiliates, representatives, officers, employees, and healthcare professionals involved in this live event shall not be liable for any malicious use of the information you have provided during the live broadcast. Unilab will not retain any personal information other than the sole purpose of this activity that will be intended by the live broadcast. Now, to introduce our moderator for this evening, he is a graduate of the Far Eastern University Nicanor Reyes Medical Foundation, and currently, he is a fellow of the following societies: Philippine Pediatric Society and the Philippine Academy of Pediatric Pulmonologists. He is also a current consultant in pediatric pulmonology for the following hospitals: Philippine Children's Medical Center, MCU Hospital, Jose R. Reyes Memorial Medical Center, and FEU Hospital. Everyone, let me introduce to you our moderator for this evening, Dr. Cesar Ong.
Thank you, Tanya, at magandang gabi sa lahat na nakatutok sa atin sa Facebook page ng Unilab. With the advent of the rainy season, an increasing number of asthma attacks can be expected. Kaya napapanahon ang pag-uusapan natin ngayong gabi. Ang ating speaker ay nagmula sa Far Eastern University Nicanor Reyes Medical Foundation. She had her residency in pediatrics and fellowship in pediatric pulmonology at the Philippine Children's Medical Center. She earned a master's degree in hospital administration from the University of the Philippines, Manila. Currently, she is a fellow and the immediate past president of the Philippine Academy of Pediatric Pulmonologists and an advisor of its research committee. She also sits at the Philippine Subspecialty Board of Pediatric Pulmonologists. She is a fellow and a member of the research committee of the Philippine Pediatric Society, the head of the section of pulmonology at PCMC, and a visiting staff at the Department of Pediatrics at the Cardinal Santos Medical Center. To talk on caring for asthma in children, please welcome Dr. Ann Fernando-Aison.
Thank you, sir, Dr. Cesar Ong, my dear mentor and friend. And good evening, parents. So today we will talk about how to care for our children with asthma during this COVID pandemic. And before I begin, let me thank Pediatrica and Unilab for inviting us to participate in this webinar and giving us this opportunity to reach out to our patients during this time. We have to wait for a few seconds for the next slide there. So our goal is to increase our understanding of asthma, know about its symptoms, anong mga symptoms niya, mga triggers, and how to keep the asthma under control, especially with COVID around. So ang unang katanungan natin, what is asthma? Asthma is a condition that affects the airways inside the lungs, and there is chronic inflammation that is associated with airway hyperresponsiveness. Ang ibig sabihin nito, meron siyang palagi ang pamamaga na may kaakibat na pagiging sensitibo ng mga daanan ng hangin. And this leads to the recurrent episodes of the symptoms of asthma, katulad ng wheezing or pagpuni, breathlessness or yung pagkahabo, chest tightness, mahigpit ang dibdib, and coughing, yung pag-uubo. So the airway hyperresponsiveness of asthma is the tendency of the airways, yung daanan ng hangin, to narrow in an exaggerated manner in response to certain triggers. So the first question to ask is, Doc, may asthma po ba ang anak ko? At pag-alamanan na nakakatulong if we are going to consider these features as we observe our child. So meron po ba silang mga respiratory symptoms katulad nung nabanggit? Wheeze, shortness of breath, cough, and or chest tightness? And asthma patients usually experience more than one of these symptoms. Hindi lang isa. Madalas, mahigit isa sa mga simptomas na ito ang kanilang nararamdaman. And these symptoms are often worse at night or early morning, pag madaling araw. And it varies over time and intensity. And there are triggers. So the next question is it asthma? So yan, tanong naman po namin yan sa aming sarili. Asthma nga ba? And this is where we use our clinical judgment. That is why nagtatanong kami sa inyo tungkol sa mga anak nyo, ang history, anong mga simptomas, and then we do a complete physical examination. There are times when we have to do a therapeutic trial. Ano ba yung therapeutic trial? Ito ay kung kailan magbibigay kami ng mga gamot, no? At oobserbahan ang response ng bata. Mga gamot katulad ng salbutamol as needed and inhaled steroids for 2 to 3 months. If there is a good response, then it is suggestive of asthma. For older children, we can do diagnostic tests for children more than 5 years of age. And all these steps are important so that we will be able to rule out other causes of wheezing in children. There's a slight delay in our slides, so please bear with us. So, for younger children, medyo mas challenging po, no? Like I said, we won't be able to do the diagnostic test. So what do? We focus on the symptom patterns. In young children, kadalasan these episodes are recurrent. Paulit-ulit, mas matagal. Tumatagal ng minsan mahigit 10 araw. And it happens often, 3 or more times in a year. And there are symptoms in between episodes. We also ask about risk factors. So doon nagtatanong ng family history of asthma or allergic rhinitis. And again, it has been found that these features increase the probability that it is asthma. So the next question is, what triggers asthma? A trigger is anything that brings on an asthma attack or makes the asthma worse, and it varies with each individual. So, pabago-bago po ang mga triggers, no? Bawat pasyente, merong kanya-kanyang triggers. At ito ang mga kalimitan, the common triggers are cigarette smoke, usok na sigarilyo, alikabok, usok na sasakyan, Pabago-bagong panahon, masasangsang na amoy, yung iba sa food preservatives or food coloring, at yung iba meron din sa gamot. Pero, merong trigger na hindi kailangan i-avoid. And that is exercise. It is the only trigger that should not be avoided. In fact, we encourage our asthma patients to be physically active. This is not only to improve their general well-being, but also it will allow us to evaluate if the asthma is under control. And if the child has exercise-induced asthma, it can be controlled by medications. So meron po mga nabibigay na mga gamot para kontrolin ang exercise-induced asthma. How about viral infections? These are the most common trigger of an acute asthma attack. And it is of concern, nakakabahala po ito. Kasi ang mga young children, especially preschool age children, have normally 6 to 8 viral respiratory tract infections per year. Now, COVID-19 is a virus. And I know marami na kayong nabasa o narinig tungkol sa virus na ito. But there is still no data if it triggers asthma. But COVID, since it is a virus, then there is that chance. And also, there is no evidence that asthmatics are at any higher risk of getting COVID-19. So, hindi ibig sabihin, asthmatic ako, mas lapitin ako sa COVID or mas makakakuha ako ng COVID. So, how do we keep our child's asthma under control? Asthma cannot be cured. Hindi po ito nagagamot. Kung may asthma ka, siya ang merong forever. No? Pero, we can control it. And to control your child's asthma, we have to go over these steps. So the first is, we have to give the child's asthma medications. Excuse me. Excuse me. So, ang relievers po ay isa sa mga medications ng asthma. And the relievers are the medicines that provide quick relief from asthma symptoms. It only takes a few minutes to work. And what they do is they relax the muscle around the airways. Binubukas ito para mas madaling huminga. But it should only be used as needed. And they can be given oral, yung iniinom lang, or inhaled, which is breath into the lungs through the mouth. So the side effects are, pwede siyang magka-tremors, fast heartbeat, or maging excitable. And examples are your salbutamol and terbutaline. Next is we have the controllers. So the controllers make the airways less sensitive or twitchy. Kasi hindi ba sabi natin, because of the airway hyperresponsiveness, nagiging sensitive sila. So yung mga controllers po, nire-reduce yung pagiging sensitive ng mga airways ng asthmatic patient. Because they do this by reducing the inflammation or yung palagi ang pamamaga dun sa daanan ng hangin. So it keeps asthma well controlled and prevents attacks. But to work properly, they need to be taken daily and for the recommended period of time. So pag sinabi ng doktor, gagamitin ito sa loob ng 1, 2 o 3 buwan, kailangan po ituloy. Meron pong dalawang types of controllers, the non-steroidal and the steroids. So ang pinaka-popular po sa non-steroidal are our anti-leukotrienes. Ang popular po dyan ay ang Montelukast. Madaling gamitin kasi iniinom lang. And our steroids are the inhaled steroids. We have the fluticasone, budesonide. Sometimes we have to combine it, use a combination with long-acting beta-2. There are also side effects, but these side effects can be avoided by using a spacer. Tinuturo po yun ng doktor bago ipagamit sa isang pasyente or doing a mouth rinse after each puff. But for severe asthma attacks, systemic steroids can be given for 5 to 10 days to get your child well quickly. Short treatments are safe when given with your doctor's advice. So kailangan po susundin ang payo ng doktor kasi hindi namin ine-encourage mag-self-medicate. So the next step is to avoid triggers. So yung mga triggers po na napag-usapan natin kanina, sinabi natin, identify, that's number 1. And number 2 is to avoid. So you really have to know what triggers your child's asthma, and you can do it by closely observing them or trial and error. Now, there are triggers that are difficult to avoid. We know that. Like viral infections, kaya ina-advise na taon-taon magpapa-flu vaccines ang mga bata, and especially the asthmatics, and also weather changes. In some patients, we have to do allergy skin testing, and so we refer to an allergologist for that. Regular doctor visits. It's a bit challenging nowadays because of what's going on. So this may have to be in the form of virtual visits through telemedicine. But it is really important, even if your child is well, just to make sure that the medications are working properly. Naaayon pa yung mga gamot na tinitake niya para sa kalagayan niya. Remember, because asthma is a condition that changes. And what we need to do is to keep it under control. So these medications are adjusted. Step up or step down depending on the level of control. Kaya I always tell my patients, a child is never on a permanent dose for a long period of time. Ina-adjust yun. At matutulungan tayo sa pag-adjust ng mga medications if we have an asthma action plan. This is the next step. All asthma patients must have a written action plan. And this will tell us what medications to give your child, what to do when the asthma is getting worse, and during an emergency. So this plan is updated. Ina-update niyo po yan whenever the medications are changed. So itong asthma action plan, kahit do it yourself. This is how it looks like. But you can make one yourself in a pad paper or a small notebook. Kailangan lang po nandun yung pangalan ng doktor, saan siya pwedeng tawagan. Ito po yung mga goals in treatment. Anong ibig sabihin? Kailangan ang goal natin, the child must be able to take part in normal physical activities. No? Kailangan active siya. So pag sinasabing, hindi naman po siya inaatake, pero laging nakaupo, laging nasa loob ng bahay, laging nag-gadget, then we won't be able to evaluate the child's asthma control. But next is, they should be able to sleep through the night without having asthma attacks. Of course, our goal is to prevent it and monitor the peak flow numbers and also avoid side effects from the medications. Now, this asthma action plan is like a traffic light signal. So, meron tayong green, yellow, and red. So, green means go, go, go. The asthma is under control. So, we will just have to continue the present medications, give salbutamol as needed only for attacks, and do regular visits with your doctor. Now, the yellow zone means you have to wait. Ika muna. Tingnan mo, observe, kasi baka nag-a-atake yung bata. And red is an emergency. So it's stop. Stop whatever you're doing because the child might be having a severe asthma attack. Ginawa po itong ganito para mas madaling maintindihan ng mga parents. Traffic light signal. So we talked about the green zone. It is go, go, go. Now, the yellow zone is, we said, wait. We keep track of the reliever medications using the asthma action plan. Now, we will be alerted that the child may be in the yellow zone if he or she has 3 to 4 of the following. So, ito yung mga symptoms ng asthma. We said, baka meron siyang wheezing, nagka-cough, or with chest tightness, masikip ang bibig sa gabi or in the morning when they wake up, and it's happening 2 or more times a week. They need the reliever 2 or more times a week. Remember, our goal is not to give the reliever as much as possible. Zero need for that. But it's not including before exercise. Or these symptoms occur while the child is doing the regular physical activity. That means, wait a minute, baka nasa yellow zone siya. So, yellow zone means that the child is having an attack, and you may see the following signs. So, ito na yung mga sintomas na sinabi natin, pero ngayon talagang parang mas hirap yung bata. Naguhuni, may wheezing. But now there's already a sucking in effect between the ribs or the neck as they breathe. And they're starting to breathe faster, no? Mas mabilis na. The abdomen, sinasabi ng pasyente, para pong nag-aalon-alon, doktora. And they have problems talking with an older child kasi hirap na sila maghinga. Kinakapos. So if you remember what we talked about the inflammation, having an attack is like breathing through a straw. Para kang humihinga sa straw. So because of the inflammation sa asthma, yung palagi ang pamamaga restricts the airway. Kaya mahirap pong pumasok ang hangin at nahihirapan ng bata. So what do? The action is we have to give a reliever. Give the salbutamol. Kung ano yung dose ni recommend ng doctor, observe the response, and then call your doctor immediately. Now, if the child is having a severe asthma attack, we say that he or she is in the red zone, and you can see the following signs or symptoms. Pagod na siya. Can't walk more than a few steps. Hindi na makapagsalita, 1 or 2 breaths. And there's little improvement after using a reliever. Or you have to give it more than every 30 minutes, and that's not good. Or nag-blue na siya sa lips, nag-fast yung kanyang breathing, and again, the tummy, the ribs, or the neck, makikita mo talagang hirap na. So, the action here is to go to the nearest hospital and emergency room. Along the way, you can give the reliever, call your doctor, but early recognition and treatment is the key. So don't waste your time. You can do all these things, give the reliever, call your doctor on the way to the ER. So COVID-19, we said, is a virus, and because of that, it can really trigger an attack. The symptoms are usually, fortunately, less severe with children. Mas mild siya kesa sa adults, no? So, maswerte lang po. Pero makakakita, pwede mag-cough, holes, fever, or diarrhea. But some of them, unfortunately, nagkakaroon din ng severe complications. 14% of them are hospitalized. 5% will even require ICU care. And there are reports na there are children who present with rashes and Kawasaki disease-like illness. But the fear of the virus should not overwhelm us. And hopefully this table will allow you to be able to differentiate asthma from COVID-19. The key signs of COVID-19, unfortunately, can be seen with asthma, like cough and shortness of breath. Hindi ba nakikita po natin sa asthma yan? Meron din po niyan ang pasyenteng may COVID. Ang wheezing o yung paghumi, mas common siya sa asthma. Kaya mas makakatulong, it will help, no, and make it easier for us to focus on the signs that will distinguish COVID-19. So ano po yun? Yung chest discomfort or chest pain, it's more frequent with COVID. Fever, more frequent with COVID. And fatigue, parang mahina ang pakiramdam. So, what we have heard, what we have read about COVID, all this, natatakot tayo lahat. So, I mentioned already, let us not this fear overwhelm us. There is still no data that COVID-19 may trigger an asthma attack. But because it is a virus, then there is that chance. But there is still no clear evidence that patients with asthma are at any higher risk of getting COVID. Hindi porke asthmatic ka, lapitin ka ng COVID. So it doesn't work that way. And if an asthmatic patient gets infected with COVID, yes, the disease may be more severe because, di ba sabi natin, the virus can cause an extra inflammation on top of the inflammation in asthma or yung palagi ang kamanagka. So that can be worse. But there is also no evidence that asthma medications to prevent symptoms like steroids, Montelukast, yung mga controllers, will increase the risk of getting COVID-19. So pag gumagamot ako nito, ibig sabihin ba, mas malaki ang chance na magkaka-COVID ako? Hindi po ganun. Kaya sana po ay lumawak ng kahit kaunti ang inyong pag-unawa sa asthma. At ito lang ang mga bili namin. Last take-home message. So for us to be able to take care of our children with asthma during this time, these are our recommendations. First, we have to continue the controllers. So kung meron po sila, ang tawag po doon, popularly known as maintenance medications, then you have to continue for the recommended period of time. Now, you can use the relievers, your salbutamol medications as needed for symptoms. You follow the asthma action plan. Strictly follow guidelines on infection control, the use of face masks, hand hygiene, physical distancing, and of course, call your doctor for any concerns. So if there is one lesson that this COVID, this lockdown, yung mga quarantine po natin have taught us, it is for us to know what our priorities should be. So, marami pong salamat sa inyong pakikinig. Thank you.
Yes, thank you so much, Dr. Mafa, for that knowledge-filled lecture. And now, to open the floor, let us all welcome back Doc Cesar for the Q&A portion. Doc Cesar.
Anya and Dr. Aison, thank you very much. That talk certainly made us understand asthma even more. Sa mga gusto po magtanong, you can type your questions sa comment section at atin po silang babasahin. But I'd like to start with the first question, Doktora. Kung wala po bang history ng hika sa pamilya, ay hindi na magkakahika ang bata?
Ang hika po, ang family history ng hika, katulad ng sinabi ko, no? So it's a risk factor for asthma. At marami ng pag-aaral ang nakita na kung merong hika sa pamilya, mga magulang, mas tumataas ang kanilang probability na magkaroon din sila ng hika. Kung walang hika ang mga magulang, alam nyo, sir, nagtatanong pa ako, how about the grandparents? Kasi sometimes it skips generations. But not having a family history of asthma will not really say that a certain patient will not have asthma or will not develop asthma. But it increases the chance.
Okay po. Doktora, meron tayong tanong galing kay Lely Nolasco. Meron po bang bawal na pagkain?
Ang food po na nagiging trigger for asthma, maliit na porsyento lang po yan. Less than 5%. Hindi po kami agad-agad nag-a-advise to give the child a hypoallergenic diet kung hindi po kinakailangan. Ano po ibig sabihin? Kung sa inyong experience or sa history ng bata, and that is why we look into the history of the child, pati yung past history niya. Kasi kung meron kayong sasabihin na pinakain ng ganitong pagkain, nag-develop ng mga simptomas, nag-allergy, nag-rash, or nag-develop ng asthma symptoms, pinaiiwasan po muna yun, panandalian, at oobserbahan, papatuloy obserbahan. Kung tuwing may encounter na yun, nagde-develop siya ng reaction, baka nga allergic siya sa food na yun. And for some patients, we refer to an allergologist para ma-skin test at mapatunayan kung ano-ano talaga saang mga bagay nagre-react or pagkain ng bata.
So, Doktora, hindi naman ibig sabihin automatic bawal ang tsokolate or bawal ang manok, itlog?
Hindi naman po. Kasi, like I said, less than 5%. ang food as a cause of or a trigger for asthma.
Okay, Doktora, mula pa rin sa ating Facebook page, is itchiness of the throat and occasional coughing a symptom of allergic asthma?
Oh, maganda pong tanong yan. Kasi hindi ba sinabi natin ang asthma mas madalas more than one of the symptoms that we mentioned, no? Hindi lang po ubo. Ngayon, kung halimbawa merong itchy throat at saka merong ubo, kailangan i-rule out po muna natin yung ibang mga kondisyon na nagkukos din po niyan. Kasi hindi lang po asthma ang nagkukos ng ubo. Meron din pong tinatawag na post-nasal drip. Kadalasan dito lang po yun sa lalamunan. Nakakakos din ng cough. Reflux, meron din. Nakakakos din ng irritation in the throat or chronic sinusitis. But there's also such a thing as cough variant asthma na ang cough variant asthma, usually dry cough, it happens late at night or early morning with good response to an anti-asthma medication. So, to answer your question, maaari, pero kailangan i-rule out po muna natin yung nabanggit ko na po, post-nasal drip or sinusitis or reflux.
Galing naman po kay Bonifacio Leda. Good evening po. Ano po magandang gawin kapag may asthmatic allergy like in the early morning?
Kung talaga po hikain kayo, kasi baka allergic rhinitis po yun. Early morning, cough lang sir, or asthma allergy in the morning?
Asthmatic allergy like in the morning.
Okay. So, we usually start with giving a short-acting beta-2. Yung pong reliever po muna. No? So, yun yung salbutamol. Bibigyan po mga 1 or 2 days. You can give it every 6 hours and observe the response. Kasi kung hika po ito, mawawala po yan. Pero kung hindi, kung yung pong asthma allergic, I suppose cough po yan, in the morning, pwede rin po kasi nga kung post-nasal drip, antihistamine po ang gamot po, hindi po anti-asthma.
Okay. Galing naman po kay Annalyn Isidro. Tanong ko lang po sana kung hanggang lumaki at tumanda ang isang asthmatic ay hindi na mawawala.
Okay. Kasi katulad sa isang slide na pinakita natin, asthma cannot be cured but it can be controlled. So, nasa genes na po ng batang yun. So, yung daanan ng hangin, minsan, sinasabi nila parang nung tumutong ng edad 7 or 8, nawawala yung asthma. Pero ang katunayan po, lumaki lang yung bata, lumawak yung airways niya or nag-widen, hindi na po masyadong sensitive katulad nung mas maliit siya. Pero kung sa kanyang pagtanda, manigarilyo siya, magtrabaho siya sa isang lugar na nandun yung mga triggers niya for his asthma, pwede po magkaroon siya ulit ng symptoms or bumalik yung asthma symptoms niya. So, yes, sa asthma, may forever.
So, Doktora, kailan po mas madalas ang sumpong? Habang bata or habang tumatanda?
Yung exposure, sir, kasi sa triggers, kung sa bata kasi physiologically speaking, mas maliliit po yung daanan ng hangin nila, diba? So, mas hindi sila nakakaiwas sa dapat nilang iwasan kasi sometimes they're so dependent, especially for young children. You have to carry them around. Unlike in adults, when you know you're allergic to dust or to smoke, so you can leave an area kung nandyan yung mga triggers. So, sasabihin ko po na mas madalas, siguro napapansin natin kasi yung mga bata pag kami nararamdaman, mas madalas nadadala sa doktor. Pero ang mga may edad, minsan may nararamdaman na sila, pero hindi nila alam hika na pala yun. Hindi sila magpapatingin.
Galing naman po kay Erlan Amores Evasco. What is your recommendation regarding Montelukas?
Montelukast is an anti-inflammatory. Like I said, it's a controller. So, yung controller po, kung kailangan na ng bata na bigyan siya nito, ginagamit araw-araw. So, merong mga pag-aaral sinasabi na less potent po siya sa inhaled steroids. Inhaled steroids pa rin ang gold standard natin. Pero, ang gamit po kasi ng Montelukast, ang advantage niya, this is oral, it's not a steroid, yet it works the same way. Mas madali pong inumin once a day at bedtime. So, because of the improvement in the patient's compliance, nagkakaroon din siya ng good response to the medication.
Galing naman po kay Recky Costello, is it safe to give a second or third dose of salbutamol if the child is not relieved by the first dose?
Okay, ang tanong ko po sa inyo, ano pong interval nung first dose dun sa pangalawa? Kasi katulad ng sinabi natin, kung ito ay kakailanganin na ng bata, earlier than every 30 minutes or more frequent than every 30 minutes, ano na po yun? Red zone. It's an emergency. That means the child has to be treated in an emergency room setting. So, kung halimbawa po ay binigay yon sa loob ng isang araw, mga every 6 or 8 hours, okay lang po yun. Ngayon, pagka ang bata mga 2 o 3 beses na ginagamit na yung kanyang o nangangailangan ng salbutamol. Again, you update your asthma action plan, call your doctor because the medication might need to be changed or adjusted, or the child may need to be started on a controller.
Dr. Flom Nemeriza Nicolas, is it normal po na kapag nag-asthma attack ang bata ay nagkakaroon din ng allergy katulad ng hives?
Yung iba po kasi pasyente, hindi lang po asthma. Kasi magkakamag-anak din po sila yung allergic rhinitis, asthma, or atopy, or skin asthma kung tawagin, katulad ng mga hives, yung mga tabulabay, or aspirin hypersensitivity, or merong allergy sa aspirin. So, opo, magkakamag-anak po yan. So, minsan, nagkakaroon siya ng asthma attack, meron din siyang hives. So, pwede po yun. Posible.
From Bellarine de Chavez Derecho, ask ko lang po, nagka-asthma attack ang anak ko nung May, then okay na po siya starting June. Need pa po ba niyang ituloy ang kanyang inhaler, ang kanyang controller, kahit na hindi na po siya ina-atake?
Kailangan po. So, sana po kung alam natin kung nag-atake siya noong May, kung nakonsulta yung doktor or kung nagpatingin, at ang tanong ko po kung na-adjust yung controller niya. Kasi dapat iisipin natin bakit siya nagka-atake. Remember, the controller, kaya nga po yung tawag sa kanya controller, is to prevent an attack. So bakit siya nagka-attack kahit na gumagamit na siya ng controller? Kailangan ba itong palitan? Kailangan ba i-adjust, itaas muna ang gamot? So kung naka-controller siya ng May, inatake siya, June okay na siya, I suppose kinontinue niyo po ang controller at July na ngayon. Ang isang tanong din po dyan, gaano katagal na po ba siya na naka-controller? So siguro ang mapapayo ko po sa inyo, huwag pong itigil hanggat hindi niyo po nakakausap yung kanyang attending doctor para na mas alam ang background or history ng bata, including the medication history, para mas maganda pong masagot kung papalitan, itataas, o ibababa yung dose.
Pero doktora, normally, gaano katagal siyang binibigay?
Normally, pagka nagsistart po ng inhaled steroids, for 2 to 3 months po yan. Pero ang advice is to do a monthly follow-up. Bakit? Kasi kung halimbawa, on the first month na iniinom or tinitake yung gamot, ay hindi umubra, nagka-atake pa rin. Hindi na huwa antayin yung second or third month, after 1 month, pwede na pong i-adjust. Ngayon, kung pagka-follow up after 1 month of taking it, okay, good, nasa green zone, go, 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 then we continue, we complete for 2 to 3 months.
So, importante, Doktora, yung follow-up.
Yes.
From Mylene Saludo, ask ko lang po kung anong gamot bawal inumin ng asthmatic patient. After every bath in the morning, sneezing po siya.
Anong gamot ang bawal? Kasi kung yung gamot na bawal po, binabawal po kung meron siyang drug allergy. So sabi ko nga po, isang trigger yon, pwede kung sa ibang pasyente kung may drug allergy siya. Pero kailangan alam po natin yun kung na-obserbahan nyo na pag umiinom siya ng a certain kind of medicine, nagkakaroon siya ng reactions or an allergic or asthmatic reaction, then we have to avoid that. Now, yung isang tanong, hatching in the morning or after taking a bath?
After taking a bath. Morning sneezing siya.
Okay, morning sneezing. So, it points to a possible allergic rhinitis. Kasi kung after taking a bath in the morning, nagsisneeze and then the entire day, the child is fine, okay lang din po yun. Kasi meron din po classification sa allergic rhinitis na kung hindi naman siya nakakadistorbo sa palagiang sa daily activities ng bata, observe pa rin po, again, pareho katulad ng asthma, allergen avoidance.
Ask ko lang po, ang Montelukast po ba pwedeng ipainom kapag na-obserba na parang hinihingal ang bata, lalo na kapag tulog sa gabi?
Kasi po kung madalas na, katulad ng sinasabi natin, unang-una ilang taon po yung bata. Kasi for young children, at hindi pa sigurado kung ito ay hika, so inuumpisahan po muna ng salbutamol, mga 1-2 araw hanggat mawala yung simptomas, i-observe, patuloy na i-observe. Pero kung yung mga ganitong pangyayari ay nagiging madalas na, mga 3 times in a certain season or kahit na hindi frequent pero grabe naman ang atake or ang sumpong, nag-uumpisa na po ng controllers. And Montelukast is classified as a controller. So we start with that, especially if there are some parents who are, we say, parang takot po sila sa steroids kaagad. Kaya po sa pag-i-explain sa mga pasyente, kadalasan ang pinipili nila mag-umpisa muna sa Montelukast as a controller.
So, Doktora, sino po yung dapat bibigyan ng Montelukast at sino yung bibigyan ng steroids?
Kung nangangailangan na po kasi ng inhaled ay ng controller. So, sa asthma treatment din po, meron kaming tinatawag na step ladder, no? Or asthma steps. We start from step 1 to step 5. At habang tumataas ka from step 1 to step 5, yung mga gamot mo nababago o nadadagdagan. Ang Montelukast po, for young children, younger than 5, we start giving controllers on step 2. And Montelukast is an alternative to inhaled steroids. But inhaled steroids is still the cornerstone for the treatment of asthma.
Doktora, galing kay Kate, kapag niresetahan po ba ng doktor ng salbutamol ng bata ng 1 beses, ang ibig sabihin ba noon na may hika na siya?
Maaari pong binigyan siya ng tinatawag na therapeutic trial kung first time lang po siyang nabigyan. So siguro po, ino-observe ng doctor yung magiging response ng bata o ng pasyente dun sa salbutamol. Kasi sabi natin, kung merong good response, it is suggestive of asthma.
So kailangan obserbahan pa yung bata para malaman.
Yes, not entirely that it is asthma right away.
Mula po kay V. Gonzalez, can allergic rhinitis lead to asthma?
Yes, because hindi naman siya yung nagiging cause. But because of meron po kaming United Airway concept na ibig sabihin, madalas kong sabihin sa mga pasyente ko, kung may mga pasyente ako dyan na nakikinig, ang daanan ng hangin natin, wala po yung gate o hindi po yung control. Magmula sa ilong hanggang po sa baba, tuloy-tuloy siya. So kung meron akong sipon na palagian, meron akong allergic rhinitis, patuloy na tumutuloy dito. Hindi po siya hanggang dito lamang, minsan nakakalusot siya hanggang sa lungs. So anong ibig sabihin po ang allergic rhinitis that is uncontrolled o hindi kontrolado, pwede po mag-trigger ng asthma. Kalaunan, hihikain na yung bata. Lalo na kung yung batang yun ay mayroon siya ng parehong kondisyon. May asthma na siya, mayroon pa siyang allergic rhinitis.
So, doktora, yung allergic rhinitis pwede mag-trigger ng asthma. Yung baligtad, doktora, yung bang asthma pwede mag-lead into allergic rhinitis?
Kasi 40% po ng pasyente na may allergic rhinitis meron ding hika. So, yung allergic rhinitis, kung hindi na nakokontrol, pwedeng it can lead to the child having an asthma attack if the child is also asthmatic. Pero kung bawa may asthma ako, magkaka-allergic rhinitis po ako, hindi naman po gano'n. Pero maraming mga pasyente, like I said, 40%, meron silang allergic rhinitis, meron din silang asthma. So because of that United Airway concept, we have to control both. We have to control this and we control also the asthma.
Okay. Doktora, galing kay LV, meron po bang bakuna to prevent asthma?
Wala pong bakuna to prevent asthma, pero meron pong bakuna, yung mga flu vaccines, to prevent the trigger na viral infections. Kasi di ba, viral infections are the most common trigger for an acute asthma attack. And that is why, especially for asthmatic patients, we encourage them to get their yearly flu vaccine.
Doktora, from Dayan, yung baby niya 7 months old pa lang. Kung merong hika yung nanay, pwede na ba magkahika ang 7 months old?
Meron po kasing tinatawag na infantile asthma. So sa mga young infants, katulad ng anak niyo po, 7 months old, no, less than 1 year old, kung talagang nasa kanya yung mga features na binanggit namin kanina for young children, recurrent yung symptoms, mas matagal, madalas nangyari, tapos nangyayari pa, kahit wala silang sipon, meron sila ng mga symptoms ng asthma, at merong family history. So kung kayo po merong asthma, tumataas po yung tsansa ng probability na may asthma din po yung anak niyo. In fact, for young children, we have a certain index that we use, a asthma predictive index. And parental history of asthma is one major risk factor for the child to have asthma at an older age. So yung 7 months old po, maaari magkaroon, lalo na po kasi kayo po ay nahika.
Tora, another question kay Avi galing. Pwede po bang gamitin ng Montelukast sa 3 buwan na bata?
Wala pa po akong experience na nagbibigay ng ganun ka bata. Kasi kung 3 buwan, dapat, di ba tanungin po muna natin, merong mga alternative conditions na nagkukos ng wheezing, hindi lang po hika. Lalo na po pagka 3 months old. It's very tricky because we really have to know a complete medical history, even the birth history, binabalikan po natin yan. Ini-examine ng maigi yung bata, tinitingnan kung mas maganda kung na-x-ray din siya at papatuloy na uobserbahan. So yung paggamit ng Montelukast po, kahit nasa empirical, hindi pa 6 months and older,
Okay.
sinasuggest.
Galing naman po kay Chair. My child got his asthma from my husband. Okay lang po ba na every time mag-start na yung ubo niya after maglaro, ay bibigyan na siya ng cetirizine?
Okay. So, ibig sabihin po yung si daddy may hika, tapos yung bata pagkatapos maglaro, may hika din. So, yung cetirizine po, iko-correct ko lang, antihistamine po siya, hindi po siya anti-asthma medication. So, yung sa paglalaro, di ba sabi natin, yun ang hindi natin pipigilan, di ba? Pero kung palagian na lagi pagka naglalaro siya, merong ganyan, tatrial mo ng salbutamol, 1-2 araw, pag tinigil at bumalik, ganun pa rin siya. Again, that's a sign that the child may need to be started on controllers. And Montelukast has been given for exercise-induced asthma also.
Doctor, 2 interesting questions coming from Roel. Why is asthma worse at night? And yung pangalawa po niyang tanong, bakit ako hinihika kapag ako ay tumatawa o kaya umiiyak?
Okay.
Roel, ikaw ba talaga yung umiiyak?
Yung pong worse at night, meron po kasi tinatawag na circadian rhythm or parang biorhythm ng katawan natin. Na pagka sa hating gabi, madaling araw, lalo na yung kung ang panahon, yung weather, di ba sa mga ganung oras, bumababa po yung temperatura, ganun din naman yung mga daanan ng hangin natin sa mga ganung oras, yun po yung pinakamasikip sila. So kung imagine niyo ang isang asthmatic, meron ng palagi ang chronic inflammation. And during that time, mas lalo pang sisikip because of that rhythm that we are talking about. Then, you will have an attack or you may have an attack. So, what do? We have to control that. So, ibigyan po kayo ng gamot. And yung next, sorry sir, yung second question niya is,
Kapag siya ay tumatawa o kaya
tumatawa or umiiyak. Okay. Yung pagtawa or pag-iyak, kasi kung yan tulad ko na lang siguro sa parang pag-ehersisyo. Bumibilis yung paghinga mo, di ba? Increase yung respiratory rate mo when you're running or when you're laughing or sobrang emotion mo, nagkakaroon po kasi ng changes dun sa daanan ng hangin natin. Ang pinaka-common theory dyan is natutuyo yung daanan ng hangin, drying of the airways. And that's why sometimes it leads to an asthma attack.
Okay, salamat po, Doktora. Meron po tayong mga tanong kaya lang wala na po tayong oras. So maraming salamat. Any last message for our audience?
Okay. Mga parents, thank you for joining us tonight. You just don't know how much we welcome this opportunity to talk to you, even through this manner, no? Para maipaabot sa inyo ang aming mga bilin. Yun lang naman ang gusto namin. So, my message is, like I said, we should not allow the fear of the virus to overwhelm us. So, kung ano po yung natutunan natin, mga kaalaman na nakuha natin ngayong gabi, sana po yun ay maging inyong gabay sa pag-aalaga ng mga anak natin na merong hika. At kung meron pa kayong mga karagdagang katanungan, please don't forget and always remember to call your doctor. Thank you.
Salamat po, Doktora. Back to you, Tanya.
Yes, thank you so much, Dr. Maka and Doc Cesar, for that knowledge-filled lecture. Maraming salamat po. I'm sure that lahat po ng parents or everybody listening to us tonight, we're able to learn more about how to care for children with asthma, especially sa panahon po ngayon ng pandemya. So, I guess, to everyone, this ends our webinar for this evening. We hope that you were able to learn something new. Maraming salamat for spending your time with us. Keep safe po sa ating lahat and good evening po to all. Thank you!
I know there are people who say I can't do it. They think I can't handle it, that I'm not fit to play the game. And they think it's better to give up now. But it's not what others say that matters. It's what the people who believe in me say that counts. I know they will always be there for me. I know they want what's best for me. Because we are family. Because for them, I can do anything. For them, I am worth believing. For them, I can. This time, I can let my voice be heard. This time, I am in control. This time, I can. This time, I can dance my way to my dreams. And nothing can stop me. Nothing can stop me. Nothing can stop me. Not even asthma.
In the Philippines, 11 million Filipinos are afflicted with asthma, and of those afflicted, more than 6 million are children. Join us. Together we can beat asthma. Child Asthma Network, an asthma awareness campaign by Pediatrica, a division of